All right, welcome everyone to a new episode of the Roscoe's Wetsuit Podcast. I am your host, Toby Passman. I have a very special guest on the show today, Dr. Cynthia Kerson. Dr. Kerson is currently the founder and director of education for the Applied Psychophysiology Education and professor at Saybrook University in the Department of Psychophysiology. She is BCIA certified in Biofeedback, Neurofeedback, and Heart Rate Variability, and holds certifications as a diplomate in QEEG and mentors applicants for all certifications. Cynthia has published many articles and chapters on biofeedback and neurofeedback, and is the co-editor of Alpha Theta Neurofeedback in the 21st century. Cynthia is the vice president of the board of directors for the Behavioral Medicine Foundation and has served on the board of AAPB as vice president of FNNR, the Foundation for Neurofeedback and Neuromodulation Research, amongst much more. So Cynthia, welcome onto the show. Thanks so much for joining me today.
Thank you. It's nice to be here.
Absolutely. So I'd like to get started just by kind of asking you what originally got you interested in this specific kind of biofeedback, neurofeedback in this whole sort of realm. What sort of piqued your interest?
Well, many years ago, let's see, about 30 years ago, I was diagnosed with Graves' disease, and my massage therapist actually suggested that biofeedback could help me to kind of, lower my, it's an autoimmune dysfunction that makes your thyroid go really, really fast. And so I needed something to kind of calm me down. And so she suggested this thing called biofeedback. I had no idea what it was. That was before Google. And I warned you, my dogs would bark. Anyway, so I went and did this thing called biofeedback. I found someone in my area who did this, and it basically changed my life. It really was an amazing learning experience about self-regulation and about how we are able to self-regulate. It was life-changing. And so I kind of got myself back, from having Graves' disease. I had to do radiation and all this kind of stuff to, slow my thyroid down and all of that. But in the process, I really learned so many things about, like I said, myself. And so I was in the garment industry at that time, and I decided I wanted to get out of the garment industry and do something where I can help people, because I felt like my life was so dramatically changed by what I learned from that practitioner. And so I did. I basically sold my business and went back to school at 38 years old as a freshman. And at 51, got my first PhD in applied psychophysiology, and a few years ago, got my second PhD in mind and body medicine. So that's pretty much the story about how I got into the field.
Right. And I want to back it up to, when you first kind of went to that practitioner and learned about biofeedback, at what stage was the field in? Because I'm guessing all of the stuff regarding QEEGs was probably, did it even exist at that point?
This was in 1997. And so QEEG did exist. Pretty much the only system were the big, huge, clunky Zscores. So you obviously couldn't take your laptop and your little head box and go and record somebody, because they were these big clunky things. And there's actually an interesting story around that I can share if you want.
Sure.
But anyway, yeah, so the QEEG existed, but very few people did it. There was no certification at the time. The guidelines for BCIA certification were much more lax. They were still kind of, building their model about certification and later on international certification. And so, yeah, no, it was the system that I learned on isn't even available anymore. It's called the Biointegrator, which is actually the predecessor to the Nexus. The Nexus was developed a lot with that system in mind. But anyway, yeah, it was pretty primitive back then
Right.
compared to today. Yeah.
Right. And so I'm curious then, so since 1997, the past couple of decades, what have been some of the most exciting developments in your opinion in the fields
Oh
of
my goodness.
biofeedback and neurofeedback, QEEG research?
Yeah. Well, my first certification was in biofeedback, and I practiced biofeedback for about maybe 3-4 years before I then got my certification in neurofeedback. The things that have developed, and so most of my practice, I would say 85% of my practice was neurofeedback. I did biofeedback, and I often did both biofeedback and neurofeedback together. And I actually sort of was the first person to write a paper on that, and got a lot of people interested in thinking about both biofeedback and neurofeedback. And then a couple of other papers were published, and people started thinking about, wow, we could be doing temperature and neurofeedback, or muscle training and SMR, and that kind of thing. So I see that that's been an evolution, and I think that's been good for the field. The sophistication on assessing the EEG, I think, has been tremendous. There are differing opinions about how to assess the EEG, and I doubt we want to discuss that in this podcast. But all models have really advanced quite a bit. The mathematics behind taking a biological electrical signal and using mathematics to actually determine where it's coming from in the brain, whether it even now be subcortical, we can actually find subcortical EEG behavior. So those are the things that I would say I'm most pleased about in the advancement of the field.
Right, right. And it might be interesting to just kind of give, if we could kind of give a brief, overview, I guess, of the field of neuro or biofeedback. Most of the listeners, now longtime listeners have, heard many podcasts on these subjects. But, as far as with neurofeedback, kind of altering the electrical rhythms of the brain through this brain training, can you tell me a little about the different fields of thought? I know I saw, you did some work with the alpha theta neurofeedback. You wrote some chapters in a textbook about that, you were the co-editor, correct, with that?
And yeah, and I
So,
wrote a chapter.
and you wrote a chapter, gotcha. So kind of, can you break down some of the different schools of thought in terms of neurofeedback?
Well, it's interesting because I'm about to actually complete the final edit. For the last 3 years, I've been interviewing Joe Camilla, and so I'm about to release his story in his words, and it's a really beautiful book. So the two, I say that because that's one camp, The other camp is the academics, and of course the father of that camp is Barry Sturman, who is someone that I've worked with and taught with for years. So there's the two camps. There's the show me the data camp, and there's the so what does that really feel like to you camp? And knowing both of those guys as well as I do, I really appreciate the melding of those two. I think it's really important to have data behind physiological or emotional or mental measures that we really can't quantify yet. And so that's I think where it would be great to see in my lifetime. It would be great to see where we can actually quantify, mental, cognitive, emotional processes through looking at the data.
Mm-hmm. Right. I don't know if you've worked at all with ERPs. I recently just heard about kind of the new kind of neurofield software. Now it's going to be able to sort of record ERPs and then be able to look at how different neuromodulation, whether that be neurofeedback, neurostimulation, how that can actually affect the ERP. And that's something, when you mentioned kind of, those two divided camps, it made me think about, kind of traditional neurology and their sort of skepticism sometimes of, the QEEG, research. But then at the same time, now with the ERPs having so much good, solid data to back those up, if we can now in the future show how that changes with neuromodulation, I think that could be a huge contribution to the field.
Absolutely. ERPs have been studied for 30 years. I think it's wonderful that Nick and Tiff are, enjoying that part of the field. It's been around for a long time. I actually wrote a couple of papers comparing EEG ERPs with fMRI in ADHD. So it's been around for a long time. And of course, being able to look at those moments in the brain when the brain is trying to decipher sensory information is really important in terms of certainly for ADHD, for seizure, not seizure, for traumatic brain injury. It's actually almost more diagnostic. What would be the term for that? More of a diagnostic tool for those applications. So I think it's great. There's also another group in Pennsylvania that's been doing a lot of work with ERPs using the WinEEG and MITSAR software. And and of course, Yuri Kropotov has been working with ERPs for, like I say, 30 years. So it's a really important part of the field. It really is.
Right. How about, as far as within just the field of neurofeedback, there's certain, a one-size-fits-all protocol is likely not to, work for everyone. And it seems like that's why there's been, these different sort of methods of training that have been developed. So I'm curious, as far as if, I know that this could probably be a very long discussion, but, briefly, could you kind of summarize, based on the research, based on your experience, working with patients, which forms of neurofeedback work well for which brains?
Students ask me that question all the time. Everybody wants a decision tree. Well, if the frontal lobe is blue, then do this. If the parietal lobe is orange, do that. And I always say, respond to the data, respond to your assessment, whatever it is. If it doesn't make sense that this person is diagnosed with ADHD, but they have this pattern that looks more like anxiety or depression or whatever, because you read in a book that that's what anxiety or depression looks like, or ADHD looks like. Don't, think about the person, and maybe the person is misdiagnosed. Maybe there is a major underlying, maybe the anxiety is the, reason for the behavior kind of thing. And so rely upon the data, and you choose your protocols according to that. Of course, thinking about what the what the symptoms are and what the goals are of the patient as well. Obviously, if you don't do an assessment and you do theta beta ratio training because that's what you learned in the book that you read, because all ADHD kids have too much frontal alpha or theta, you could be making things worse because they could have a fast beta, or they could have dysregulated alpha. And not only are you not doing what should be done, but you're also going backwards, because in the case of spindling beta, if you're increasing beta, you're going to make this person worse. Just like It's the same thing like with medication. How many psychiatrists prescribe medication without looking at the organ? It's, I work with psychiatrists, I mentor and supervise and consult, and, it just blows my mind that, they will prescribe a medication based upon the EEG, and it's just such a disservice to not look at the EEG before you prescribe a medication.
Absolutely. There's a couple points related to what you said that I want to talk about. First of which, you mentioned about, if you train incorrectly, you could actually make someone worse potentially. Is that something that worries you, either now or in the future, as far as this technology kind of expands, more people get their hands on it, but people that may not necessarily know what they're doing, and they could actually, make people's brains worse?
Well, yes, they can absolutely do that. There can be so many adverse effects to doing bad neurofeedback, or even biofeedback for that matter. The other thing that's really unfortunate about that, though, is that these people are doing bad work, and so their clients aren't getting better or are getting worse, and they stop coming and they tell all their friends, oh, don't do that. That didn't work for me. It was
Mm,
awful. And that's it's a terrible thing for the field. We are really, those of us in this field, our little pond, we're just absolutely in love with this field. And we have all kinds of data and anecdotes and personal experiences that were, groundbreaking and life-saving and changing and whatever. And, to have a person doing bad biofeedback, and to have that kind of communication, from the patients is obviously really incredibly bad for the field.
right, right. And then the second thing, I kind of wanted to ask you, as far as, I guess, as the field sort of expands, what different, how are we going to see this whole field changing, do you think, in the future?
Well, one of the things that I really appreciate from having my relationship with Joe Camilla is thinking outside of the clinical box. In fact, the name of the book is Thinking Inside the Box, but thinking outside that clinical box. Biofeedback and neurofeedback, um, for self-actualization, for self-exploration, is a beautiful modality. It shortens the length of time that it takes someone to really get to know themselves, because they can get to know themselves through their physiology, as well as through their physiological reaction to emotions and things like that. And it could really speed up that process. Yeah.
Right. And that's something that really interests me, because I mean, I talk to patients about this sometimes. It's like, it doesn't make sense to me. It's like, we all go to the gym, to train and strengthen our muscles. We don't only go when our shoulder hurts. It's
Right.
so, to me, I've always really been interested in that kind of peak performance aspect. So
Mhm.
you think that area is going to really expand in the future?
That area is majorly expanding right now. We actually, so you mentioned earlier that I'm a professor at Saybrook University in the Psychophysiology department, which I am. I teach biofeedback, neurofeedback, advanced courses, neuroanatomy and physiology. Used to teach the stimulation technologies class, but um, we just developed a master's in peak performance for athletes, performers, corporate, that whole thing. We just
Hmm.
developed, we got approved, and we're starting to recruit for that master's program. So
Interesting.
yeah, it's becoming very important. Yeah.
Right. So this master's program, this is to train people who are planning on working with these athletes, peak performers.
Right.
That's super interesting.
Yeah. Yeah. And there are quite a few, like most of the Olympic teams have biofeedback practices, and as well as a lot of the U.S. football teams and whatever are really wrapping their minds around understanding their physiology in order to stay absolutely present and in the game, and
Right.
advancing their performance. Yeah.
Right. I was super fascinated. I don't know if you've seen, like, on that there's a website, totaltdcs.com, and they have listed the specific montage, basically where the electrodes are placed for those people who are listening, where they found that the DARPA, the Department of Defense, found that it doubled learning speed in snipers, which I thought was crazy. Doubled? I mean, and from what I had seen, there's been some replication studies that seem to back that up.
Mm-hmm.
So,
However, with TDCS and expanding on what I said earlier, you got to do an assessment. You don't just take a protocol out of the box. You got to do an EEG assessment, and you might tweak it a little bit. You might change the frequency. You might change the location just slightly, whatever. But it's really important to do an assessment first.
Right. Back to something that we briefly mentioned earlier, as far as the EEG and practitioners prescribing medications. I'm curious because it seems like there's huge opportunity in that realm to look at, okay, this person's brain, we gave them a certain medication, their brain on the EEG looks even more dysregulated. Maybe we should try a different medication. Are there people doing that right now? Is that something that's going to happen more in the future? What's your take on that?
I hope it's something that happens more in the future. I'm not in clinical practice anymore. I haven't been for 4 years, almost 4 years. And, but it was just, I'm sure it was terrible when someone would come in, being, trying a new medication or whatever, and you can just see the progression of them, giving them a, I don't know, some medication that either makes them too drowsy because they already have a slow brain, or makes them too hyped up because they already have a fast brain. So I think, being able to, there were many times where I would try to talk to the prescriber, like, hey, I've done a recording of this kid's EEG or this person's EEG, and it would probably make sense for you to try a different class of medication. And some were responsive, and some were like, who are you? Why do I want to even talk to you? Why, that kind of thing. So that, is really frustrating. It's very frustrating because we really do have a gold mine here. And why we are so, I don't know, dissed by the medical field is just, it's beyond me. It makes absolutely no sense.
Right. What's your take as far as, I guess supplements or natural approaches? Does that, can that modify the EEG in, powerful ways as a medication could, or, do you think that medication should still kind of be the first line approach for psychiatry and psychology?
I don't think that medication should be the first line of approach. I think teaching someone to self-regulate is probably going to be a much bigger life lesson, life skill, than popping a pill to make your depression go away. So I don't. But in terms of getting to your question about supplements. When I have ever seen a really slow EEG, just a really low metabolism, a lot of delta, slow EEG, I would suggest, omegas, vitamin D, vitamin Bs. Bs are really great. Even get B shots, to really kind of boost your brain metabolism. So yeah, I think everything that you have in your toolbox, you should use. There's no one, protocol that everyone in some population should follow.
Right. Absolutely. Okay. And then I guess I was wondering, as far as, with, with with the QEEG, and kind of evaluating the different, I mean, there's so many different parameters I guess you can look at. I'm curious as far as what's your take on, Z-scores versus more of the absolute, raw data. Do you look at both? How do you go about assessing that?
Yeah, I look at both, and I teach to look at both. When I teach QEEG, I teach really how to read the EEG. I don't go straight to the Z-scores. I look at the Z-scores, they're very important, but if they don't corroborate with the raw, I tend to trust the raw more. And also I want my students to, when they're done with me, I want for them to look at an EEG and to not even have to look at a map or a spectral, to be able to read that EEG and have that information. And it's sort of like the way that I teach is like, okay, test yourself. What do you think this map is going to look like? And then you look at the map and you go, oh, I didn't see that, that aspect. Let me go back to the raw and see what that looks like. So I think that in our field, it's, some people want to jump right into doing, 19 channel Z-score training because that's the cool thing that people are doing. And I'm like, I'm not your right mentor. I want you to learn, why you would do a one-channel EEG and do one-channel EEGs, neurofeedback sessions for a while, because that is so foundational. That's so important. You skip so much important information and you rely too much upon the software to tell you what to do. And so you're not smart enough. I don't want to maybe use that word. You're not knowledgeable enough to say, wait a minute, no, I don't think this is the right thing for this person. You trust too much the software, and this is just a math algorithm. You really need to rely upon your understanding and your knowledge and your, your observations of the patient too. That's really important.
Right. What can you tell me about, head injuries, especially kind of mild TBIs and the EEG? Because I know, again, there's kind of a division, with neurology, kind of treating this in a certain way. And then, now people who are looking at this, at least from my work, it's pretty darn common to see, people who've come in with, lots of head injuries, oftentimes correlating with when their symptoms of depression, anxiety, ADHD kind of originated. But they were never actually treated for that head injury. They oftentimes just went to the hospital, got an MRI. They were told they had a mild concussion, and that was pretty much that. So what's the frequency of kind of finding that sort of in a clinical case, and then how do you think that should be approached?
Again, assessment, and be careful, because too soon after a head injury, the brain is repairing itself, and so we need to give the brain some time. If we did an EEG right away, we would see a lot of slow stuff because the brain is basically shutting down and using its energy to repair itself. And people, oh, well, let's get rid of all that theta. Well, you're getting in the way of the brain's repair. And so I would usually wait a few months, and then, and because the brain will repair very quickly if you allow it to naturally repair itself, and you'll be so many steps further along, and then you'll have a better idea about where the pathologies will lie after the brain starts boosting itself back up again. So yes, you're going to get behavioral correlation with frontal lobe as opposed to temporal lobe injuries, right? You're going to have behavioral changes for, depending upon where the injury actually occurred. The hardest one to manage is a blast injury, because a blast injury is the whole brain being shook up, as opposed to getting a whack on, at your, left temporal or something like that. So those are more difficult to manage. Again, you need to do an assessment. And when it comes to TBI, my feeling is you should give the brain some time to repair itself before you jump in.
Right. Absolutely. Okay. Well, Cynthia, this has been great having you on. Is there anything you think that we haven't touched on as far as the field? I think I've asked you all the questions that I was curious about.
Thank you. I would like to plug Saybrook for those of you who are thinking about getting a PhD in applied psychophysiology. Saybrook is a hybrid distance learning program with an amazing faculty. Some of the best people in the field teach in our program, and it's growing tremendously. And we're a WASC accredited university, so you can do a lot with what you would learn in that program. So I want to do that, and I already plugged my book that's coming out soon, my Jokimia book that Tom Calora and I worked on together.
When can we expect that?
I think within the next month.
Awesome.
Yeah, I'm going to be sending it to the publisher in probably by the end of next week. So
That's awesome. Congratulations.
I know. I've been working on this for 3 years, and you know what? I have to say thank you, COVID-19, because my days got very different with COVID-19, and I had the opportunity to sit down and get that book done. So
Right.
there is lemonade made out of lemons there.
Yes, absolutely.
Yeah.
One last question I have for you, if someone is listening to the show and is interested in, they want to maybe, visit a neurofeedback or biofeedback practitioner, I kind of already have an idea of what you may say, but what kind of qualifications would you look for, experience? How can someone find, kind of back to the point of, you don't want someone who doesn't know what they're doing having this technology in their hands and might, actually make your brain worse. How should someone go about finding a good practitioner?
So you're saying a prospective patient, client?
Exactly, yeah. And someone could be peak performance, could be, clinical.
Right. Well, I think you probably already assumed that I would say that, look for certified people, go to the BCIA website and look for people in your area, or Google it or whatever. I also strongly suggest that you don't just find one person to interview. You can get on the phone and you can talk to a few different practitioners, and you'll get a feel for which one you vacillate with, and which one sounds more educated. Look at their credentials. Are they licensed? Are they, is it a, not that I mean to bash chiropractors, but is it a chiropractor doing some neurofeedback thing that they really aren't? They might be brilliant, lovely, chiropractors, but they really might not have the neurofeedback skills that they need, or the right staff to be able to, provide the modality in a way that it should be provided.
Absolutely. Great. Well, if you guys enjoyed the show today, go ahead and check us out on YouTube at Roscoe's Wetsuit. That is where you can see both the audio and video version of the podcast. You can also find just the audio on Spotify, Apple Podcasts, and iHeartRadio. Cynthia, again, thanks so much for being on the show today.
You're welcome. My pleasure.
All right. Take care.